Thank you for joining us today for the web tutorial, How to Complete the Therapy Provider Report. I would now like to welcome our guest therapy providers.
Hi, I'm Nancy Butts. I'm a physical therapist.
And I'm Jan Jesse, also a physical therapist. We work with Professional Therapies of Roanoke, which is a Cora clinic.
Both of these reports contain the same information. It is just the time frames that are different. Following the state fiscal year, the first reporting period will be from July 1st through December 31st of any given year, representing the mid-year report. The second reporting period is from January 1st through June 30th of any given year, representing the year-end report. If you provide services for more than one catchment area in the state, then you will need to provide reports specific to the infants and toddlers you serve for that specific catchment area. One report is filled out for each period for each catchment area. The completed reports are sent to the local infant and toddler system to be included in their reporting to the state. The local system will give you a date to return the form in order for them to compile their reports prior to the due date. I recommend setting up your patients in your computer or your manual tracking system with different codes for each catchment area. That way, you should be able to pull out the services provided and the payments you receive separately by each catchment area. Although the services provided in Section 1 and the costs in Section 2 are separated by discipline or service provider, the payments you report are aggregated just by payer source, making that part much easier to capture.
It is always helpful to go ahead and gather your data by catchment area before you begin completing the reports. Section 1, the first section, includes the number of 15-minute units for each type of service you provide. Keep in mind that you are not reporting what you charge, just the number of units provided in the reporting period. Section 2 reflects the actual cost of providing any service coordination. Section 3 asks for a breakdown of the money you have received from different sources for the services you rendered in that catchment area. These totals reflect the actual amounts you received or deposited during that 6-month period of time. This has nothing to do with when the services were delivered, only the money you received. You need not include the payments you received from Part C because the local system includes these in their expenditure reports submitted to the state. Now we're going to look at the individual provider report, and we're going to look at the mid-year report to start out with. Again, the dates that are provided there show you that the mid-year report reflects July 1st of a given year through December 31st. In that first section, you're reporting the service units, accrual base. That means those that were actually provided, the total number of 15-minute units for each service, including those assessments that you provided. So in our report, you'll notice that we have, for physical therapy, we have 1,960 units provided. Occupational therapy was 348 units, and speech pathology was 1,887 units. We did not have developmental services, but the next line is where you would provide the number of units for that, and the following line provides the number of nursing units. There's also a place for you to put other services if you happen to provide those, and those would include things like vision and social work. In Section 2, you're going to discuss discuss and cover your service coordination for your case management cost. In this block, you're going to put the salary, the benefits, and the mileage cost for those people that are providing your service coordination services in the home. In Section 3, you will discuss revenue. This revenue is cash-based, which means that you don't include, or you only include those things that you actually deposit during that 6-month period. It's the amount collected from each source. You'll see from our report that the Medicaid, which includes the fee-for-service Medicaid and the MCOs, the Managed Care Organizations, we received $91,185.17. If you provide Medicaid EI targeted case management, you would reflect what you received for that in that next line, and famous on the following line. We recorded TRICARE payments of $223.84 during the period, and all the other insurances are aggregated together, and we reported $23,746.31 there. We collected family fees of $4,701.35. There is a place again for other sources. This could include, say, the birth injury fund, and anything else that where you receive money for those services. The total that we reflected for that period of time was $119,856.67. Our local systems like for us to include our contact information at the bottom of the form. This is not a state requirement, but you will find from your local systems whether they would like for you to include that. We provide them with the person's name completing the form and also a callback number so that they can call us with any questions. This completes the tutorial for the therapy provider reporting.
Thank you, Jan and Nancy, for your assistance today. If you have further questions regarding the therapy provider report, please feel free to reach out to your local systems technical assistance consultant or monitoring consultant. Have a great day.